All right, good morning. We're going to open the hearing today for Senate Health and Human Services. And I'll ask Senator Abard to lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'll take a motion to go into executive session.
So moved.
A motion and a second. All those in favor say aye.
Aye.
Any opposed? All right, we're in executive session. So we've got two hearings today. First one starting at 9:45. We're going to hopefully exec a number of bills right now. As I walked in, I had a number of things placed in front of me, so we may do some now and we may do some at the end of the hearings, depending on our schedule and feedback that we're waiting on. So. Let's start with Senate Bill 544.
I move on to pass.
I'll make the second. So the motion on 544 is ought to pass. Senator Prentice, do you want to move amendment or do you want me to move it? I'll move it. 0944S.
I'll help. Go ahead.
All right.
Thank you.
So the amendment before you is, as we recall, this is the bill that Senator Fenton brought in that deals with changing drug formularies midstream and the fact that sometimes the notification of those catches people off guard. The testimony we heard not only from the public, but some other stakeholders identified this as a problem. Department of Insurance came in and they said there is a mechanism for this to deal with this. And actually during the testimony, we heard the people that were affected by this actually did not use this mechanism. The amendment that is before you actually increases the notification timeline to give folks more time to appeal a formulary change. And also a denial of that will be considered an adverse determination, which will move that into another classification of dealing with this through the Department of Insurance. There are a couple things in there that made it dealing with maximum allowable cost that touches into reimbursements of these drugs and what that means for the folks dispensing them and how that affects that. So that's what the amendment does. We're going to see this language in another amendment coming up, but I think having it in two places would serve the public well with that. So if there's any further discussion on Senate Bill 54 or the amendment, I'll call the vote on the amendment. All those in favor say aye.
Aye.
Any opposed? So the motion is ought to pass as amended. All those in favor, any further discussion on that? All those in favor say aye.
Aye.
Any opposed?
Aye.
We got one opposition? Okay. Would you be opposed to consent? So we're going to motion, I'll move to for consent. All those in favor say aye.
Aye. I'll second.
Who's going to take it out?
I can take it out. Or actually, Senator Prentice, do you want to take it out? Yes. All right. We're going to move on to Senate Bill 546 FN. I move interim study on 546. I have a second.
Second.
Senator Abard seconds. And just to comment on this briefly, we heard from, this would set up a secret shopper audit requirement for health insurance carriers. I'm not opposed to the concept. CMS is doing this. But what we heard from the insurance department is they are rewriting rules as we speak, and they feel like the rules will address network adequacy as we move forward, and they felt that the issues raised in testimony would be addressed by rules. Any further discussion on 546?
Thank you, Chair Rochford. I'd prefer and to pass on this, but with the pending rule writing from the department, I can live with an interim study, but I'll be looking, and I'm looking over at my friends from the Department of Insurance. We're anxious to see this come forward, and if it doesn't, expect to, as you know, experience a Groundhog Day. Thank you. Thank you very much.
Any further discussion on 546? With that, a motion is interim study. All those in favor say aye.
Aye.
Any opposed?
Consent.
Senator Abard moves consent.
Second.
Senator Birdsell seconds that. All those in favor say aye.
Aye.
Any opposed? And I can take that out.
I'll take it out.
All right, Senator Birdsell will take it out. All right. Are you ready, Sophie, for the next one? Let's move on to 547.
Interim study.
Senator Birdsell moves interim study.
Second.
Senator Abard seconds that.
Wait a minute. Is this the one that we were talking?
Nope.
Okay. Right. I'm moving them.
Senator Birdsell moves interim study. Senator Abard seconds that. Is there any discussion? So I have some comments I would like to make on this. So I would comment on that this is a very good bill. I think the language in there is an excellent starting place for improving regulation and transparency in pharmacy benefit manager practices in the state of New Hampshire. One of the points that Senator Rosenwald brought up is classification of PBMs as a fiduciary. We're going to be seeing another amendment to another bill later today that addresses that. Another issue that she had in her bill was reporting and transparency of reporting. That has been addressed in the upcoming amendment that we're going to be working with. So I feel confident that even though this bill is moving to interim study, the major points brought up in this piece of legislation will be addressed in other pieces. So with that, is there any further discussion? So the motion is interim study. All those in favor say aye.
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 Any opposed?
Consent.
All right, Senator Abard moves consent.
Second.
Senator Birdsell seconds that. I'm on this one. I can take that one out. Oh, yes. All those in favor say aye.
Aye.
Any opposed? I'll take that one out, so. Do we have an amendment for 549? Okay. We don't have, are we expect? Yeah. We won't have, okay. Do we know if that's gonna be replace all?
Isn't that your amendment?
Yeah, I've got an amendment as well, but he was gonna work on another one. Let's move, I'm gonna move Octopath on 549. And if he's got something that needs to be addressed on the floor, we can do that. So I'll move Octopath on 549.
Wait,
Second.
Yeah, dude,
I second.
we have,
oh, because you have an amendment.
yeah, I've got an amendment.
Okay.
So then I'm gonna move amendment 20260758S.
Second.
Senator Avard seconds that, and just for discussion, so the point around this, the testimony that we heard was really trying to get to the point was really getting to the fact that there are a lot of needles showing up on the streets. And he brought up the example of a lot of needles in Manchester. I think every one of us in every one of our communities has seen needles. I've come across them just within the last month or so in the little town of Littleton. And the purpose of this was to really take a look at where are these needles coming from, why are they ending up on the streets, and why are they not ending up being disposed of properly. We heard testimony that this would go after other forms of harm reduction. That was clarified in testimony. That this wouldn't, and going back to what the prime sponsor was looking for, it's really cleaning up the needles on the streets. With that, I worked with some folks to draft this amendment 0758, and one of the concerns, one of the ideas brought up is a one-to-one needle exchange, and having spoken to some folks in the community, and there are often times that people pick up and bring in more needles than they actually get. So one-to-one would actually work contrary to that because they're getting back more needles. There's another concept out there of 100% based on weight. So a needle dispensary would only be able to dispense the amount of needles that they take in, and it's done by weight. This amendment looks more at disposal. So it requires folks that are dispensing needles to have proper disposal for used needles and other paraphernalia. They have to provide education on proper disposal, and it goes on really the disposal part of it, not the dispensing part of it. I'm anxious to see what Senator Murphy, I did speak with Senator Murphy prior to the break. He was going to reach out to HHS to come up with something different. So I'm open and willing to hear what he has, but at this point, in order to keep this thing moving forward, I brought this amendment forward because I think it is an issue that needs to be addressed. It's an issue I'm hearing about in my communities. So I'm willing to bring this amendment forward to keep the bill moving. So.
And I can vouch for what regarding the needles. We put on a concert in Manchester under the bridge for the Chill Fest, their annual Chill Fest, and there were children in the audience. And one of our senators had filled basically a box with needles that were in the parking lot. Across the street in Elm Street, we put on another concert, just loading up the equipment, and in the back of the street, there's needles. It's a problem. And a kid could get that, and or an innocent person could just get stuck with that and get hepatitis or something. But something has to be done, and so I support moving forward with this.
Yeah, I agree, and I agree with something has to be done. And I see both sides of it in that I think just up in Maine over the last year they had an outbreak of an HIV outbreak because of dirty needles. So you see the purpose of clean needles. But at the same point, if there's a bunch of dirty needles lying around the street,
and you're desperate,
or you're desperate, or you're a kid playing with whatever, trying to clean them up, and they get stuck. I mean, the amount of needles that are on the street, that's what we're trying to get at. And you know, I think this amendment here will help bridge that. And again, I'm eager to see what Senator Murphy brings in on the floor, and we can see if we can't even move the needle a little more. So, no pun intended. Well, maybe there was a pun intended.
You're a dad.
Hey, Senator Long.
Thank you, Mr. Chairman. So the needle exchange does save on diseases. I believe that firmly. I know Manchester has been talking for years, that currently they're doing a one-on-one exchange. And I know they've spoken on years on getting disposal boxes. And from what I heard in testimony, that those have helped. So I'm hoping that this would reduce the needles that are thrown on the streets. Thank you.
Very good. Any further discussion? So on the amendment, zero, so we've got ought to pass on the amendment. Do I have a second?
Yeah.
Or do we already have that?
We already did that.
Yeah, so we're gonna vote on the amendment. All those in favor say aye.
Aye.
Any opposed?
Move out to pass as amended.
Motion is ought to pass as amended. Senator Birdsell seconds that. All those in favor say aye.
Aye.
Any opposed?
Consent?
Do we want to put it on consent if he's coming with an floor amendment?
No, if he's got one.
We'll leave it off and,
I
we'll,
withdraw that.
Do you want me to take that?
I can.
Sure. Or Senator Long, we'll take it out?
Sure.
Okay. All right, Senate Bill 612.
I will move interim study.
I'll second.
Senator Birdsell moves interim study. Senator Prentice seconds that. Any further discussion?
If I may, Mr. Chair, this is, it's not the first time that we've heard either this bill or this type of bill. And what is reassuring me to support interim study is the continued efforts of the department in discussions with Henry Littman and Melissa Hardy as they are working to improve the processes that were discussed during the hearing. So that is why I can support interim study. We're further than we were last year and the year before on this. We're gonna get to a place where we meet the ultimate goal. So thank you.
The concern I have is, it's come to my attention though, at some point, people are still being taken off, not being serviced, and we were promised that they would not be cut. We sent out a letter. I'm going to support the interim study, but I'm definitely concerned still. I hear words, I want action. I'm like up to here. So people that need the services, and they should not be cut. And I'm making it clear. But I will support the interim study.
Okay.
Thank you, Senator.
Any further discussion? So motion is interim study. All those in favor say aye.
Aye.
Any opposed? I'll move consent.
Second?
Senator Birdsell seconds that. All those in favor say aye.
Aye.
Any opposed? Senator Abar, do you want to take that one out?
Yep. Thank you.
Oh, do you want to do that? I can take that. It's your own bill. I can.
It's my bill, I'll kill it.
All right. Sounds good.
Just checking. It's on consent, right?
Yes. $614.
I'll make a motion of ought to pass.
I'll second that.
I know we have an amendment.
Yeah, we do have an amendment. I'm gonna move amendment 2026-1016S.
Second?
Makes it much better.
I know this amendment came out late yesterday. I have had a chance to look at it. I've been in contact with the Department of Insurance over the last several weeks about the amendment. They were very much involved in drafting that. They're here today. If we want to ask them to come up and speak to that.
And walk us through it.
Yeah.
Yeah.
So could the department come and walk us through that?
Thank you, Mr. Chairman, members of the committee. For the record, DJ Betancourt. I have the pleasure of serving as the Commissioner of the New Hampshire Insurance Department. I'm joined by Emily Dory, the legal counsel for the Property and Casualty Division. Emily did the lion's share of this work, and Mr. Chairman, we can walk through this as slowly or as fast as you'd like. There's a lot here. I have to say I've gotten the department involved in a lot of creative projects over my tenure. This might have been the one that I most underestimated the amount of work that was going to be involved. I'm lucky that Emily's still talking to me, frankly. But the issue is so important because remember the premise we started from was we needed to take alternative approaches to finding ways to address the affordability and accessibility issue with respect to liability insurance. And Senator Ricciardi put forward a new concept from ones that we've discussed with you and the legislature you have discussed in the past. So the question became how to set this up, because essentially what you're looking at is a mechanism of self-insurance where entities that are most impacted by this affordability and accessibility problem with regard to liability insurance can come together, can pool their risk, and get more affordable coverage than what the commercial market is currently offering because that market is so hard right now. And I think that I've taken you through the dynamics that have caused that particular hard market, but certainly we can get into that further if you wish. So when we started this, Senator Ricciardi conceptually had a very good idea. And as I said, it was a mechanism of self-insurance. But we had to actually put structure and meat on the bones a little bit and to find ways to enhance it so that as it gets operationalized, it becomes viable. And so there are really two mechanisms that we look to. One is a risk retention group model. The other is a captive model. The captive model, I think, is what Senator Ricciardi started with when she looked at the Texas law and tried to mirror that in her proposal. There's one problem, however, for us here in New Hampshire, and that is we do not have a captive law. So we did not have a law by which to ground the structure of this. So instead, we had to import as many aspects of a risk retention group as we possibly could and put structure around this in that manner. And then, of course, we had to make a series of policy decisions such as, this is not trying to resemble a FAIR plan. There's no assessment to the industry to fund this. It is simply something that the state has organized and will oversee, but ultimately the entities that need the coverage will have to pool together, and it will probably take some time for that pool to reach the point where it is operational to be able to offer the coverage. You have to have a risk pool that's big enough and wide enough so that your solvency principles hold up. So it's going to take time. This is the first step in a longer process, but we had to decide what those solvency guidelines were going to be, what our oversight role was going to be. And we tried to take a very moderate approach, a very down-the-middle approach in creating this because it is something that is new for this state. And so I'll stop there and I'll turn it over to Emily to get into the specifics, but needless to say, we'll both be around for questions.
Hello again. I'm Emily Doherty. As the commissioner went through, this would essentially be a form of entities being able to come together to form, in essence, sort of a risk pool. They would be able to, through this, insure liability risks, self-insure liability risks, jointly purchase insurance and reinsurance, and contract. These would provide a regulated way for these risk pools to develop, and for, as the commissioner mentioned, for us to have some oversight over those. In essence, these care arrangements would have to apply to the department, meet certain thresholds that would allow the department to understand their governance, what sort of claims policies they're offering, what they have for financials, how they're set up, how it's being run, if it's through a board, if it's if it's trust, what the arrangement is. And this would be for certain groups. It would be for nonprofit or for-profit, childcare, foster care placement, daycare, behavioral health services, for risk pooling as to the liability risks. Have some similarity to insurance in the sense that they would have to be actuarially sound to meet other financial thresholds. They would have to receive service of process through the department. They would have certain annual reporting requirements to the department, again, which allow the department to see the financial status, the governance, etc. And they would have to file plans of operation and management, which would allow the department to understand how they're endeavoring to operate. And the department would have to approve those plans. And again, they would have to be backed up by support that these entities are submitting in support of these arrangements. The commissioner would have certain regulatory authority that the commissioner currently has over insurance entities to investigate for fraud, make sure that the claims are being fairly, evaluated and processed, and also the ability to suspend or revoke the arrangements or to impose penalties if necessary, and importantly to keep tabs on the financial condition of these arrangements, and then also to make rules. And it also just, looks down the road and contemplates, what would happen if one of these arrangements ends, what would happen there. So it tries to address that. And also if there was, if one of these did have the unfortunate of getting some sort of financial issue, how would it be rehabilitated or dissolved? So it tries to address different aspects similar to what the department would do with an insurance entity, but to give some leeway to these groups that have sometimes difficulty obtaining insurance in the regular market, but to still provide oversight. So
From our discussions previously, not only at the hearing and subsequently to that, there was the concept of critical mass. We just don't have critical mass. And just so I'm fully understanding this, I did read through the amendment last night. This is setting up the framework for when we do have a critical mass to implement this. How far are we away from that? And it maybe that's just probably for my own edification. I know it's not pressing today, but how far are we away from that?
I'm lousy at predictions, but what I will say is, what I have discovered since we started this project is that we are probably closer than I thought we would be when we first started. And the reason I say that is because I've continued and have in fact intensified my conversations with my fellow commissioners across the country about this issue. And it is impacting more states than I initially appreciated. And so because we've opened up the ability for entities from other states to be able to join this risk pool, the need is out there. The demand for the coverage is certainly out there. And so bringing this opportunity online, I think, is going to be something that a lot of entities and a lot of states are going to take a very, very serious look at. So I'm not going to tell you it's going to happen in a year or two, but I'll tell you it won't take decades.
And just again, for my own clarification, this initially was introduced as a risk pool, but if I heard right, I think maybe the proper term would be a retention pool.
So it was originally structured as a captive, because that's how
Okay.
Texas had structured their law, and that's what Senator Ricciardi borrowed from, which is a great idea. There were two problems that we ran into. The first is, again, New Hampshire doesn't have a captive statute, so we didn't have other statutes to draw down authority from as we created this structure. And let me just add too, to kind of summarize what Emily provided you in some great detail, the advantages to self-insurance, the advantages to a captive or risk retention group is that it gets you away from some of the more traditional insurance regulations that you'd be subjected to if you were a typical commercial product. The downside of that is that insurance departments don't have the oversight and the ability to look into how things are operating. Most importantly, are things remaining solvent and financially healthy within that entity? So we tried to borrow the best of both worlds, to give flexibility on the regulatory side so that we could make this viable, while on the other hand, not completely giving up our ability to be able to provide basic consumer protection. And so we tried to strike that balance a bit. So anyway, Mr. Chairman, I think that answers your question. but
Well, I
may have
guess
forgotten
maybe
to-
going back to, as a follow-up, the title of the bill as of now is establishing pooled risk management programs.
Right.
With the adoption of this amendment, is that an accurate description of the
Yes.
the title? So the
Yes.
title will remain
Yes.
relevant? Okay, that's, I guess, my question. Senator Abar.
Just quickly, it's a fiscal note. I don't see one.
I don't believe that we had an opportunity to do an updated fiscal note, but we certainly can try to turn that around before it hits the Senate floor so you all can see. I would just add the other thing I remembered, the other challenge we ran into with trying to import the Texas law here is that Texas has never had to implement their program because they have such robust tort reform laws on their books that they don't have as hard a market in Texas as most of the rest of the country. So it was a nice looking law, but just no experience for us to draw from or be able to learn from. So that was another little bit of a challenge we ran into. Thank you.
Senator Birdsell.
Thank you. And thank you for taking my question. Being on finance, we've dealt with risk pools, and I'm a little shy. Is anyone, what, if it's going to be truly a risk pool, is there going to be an organization that is kind of managing this?
Yes,
And
it
if
will
so,
be.
who?
It will be governed by a board.
Okay.
And Emily, do you want to walk them through the board, the governance section?
That's what I'm, that's the question.
As I mentioned, just in the, just taking a step back for a second, just in the application, I mean, they have to give a lot of detail, these entities, when they're applying. They have to, besides just providing all the coverage, they have to explain where all their capital and their proposed rates, projected premiums are coming from, what their claim reserving practices are going to be. If they've purchased insurance to sit above what the risk pool, what the the self-insurance group is offering, what bylaws, charters, trust, whatever they're conforming to, what the agreements are going to be between the participants and the entity, and then, detailed accounting in terms of their depositing investment practices, what those are going to be. They have to meet actuarial thresholds. The commissioner under this bill won't be able to approve a plan unless the commissioner determines the plan is designed to provide sufficient revenue to pay current and future liabilities as determined in accordance with sound actuarial principles. As part of, that has to be established at the outset, and this is something that will continue to be monitored in terms of down the future as the company does, as these entities do reporting, and as the commissioner has the ability to ask for an exam of these entities to see how they're doing as it's moving along. In terms of how they're acting in accordance, they have to, as I mentioned, stay in accordance with their plans of operation and management. And as I mentioned, there's a section that talks about the financial condition of these entities where in 405C14.
Senator, I think you were specifically referring to governance.
I'm sorry.
That's okay. You can find that on page 4, beginning on line 14. And it kind of takes you through who the individuals will be, kind of their qualifications, what they're tasked with doing. But I think as Emily well explained, you can take a look at the specifics of what the board will do there, but
Okay,
backstopped by them at every point will be the expertise of the department.
that's, okay, that's what I wanted to know. Okay. I just want to make sure school care and health trust will not be involved, will they?
Absolutely not.
Thank you.
Any further questions?
And I say that because Primex provides that coverage to municipalities and school districts now, and we actually talked with them as part of our thought process in this bill, and they're doing a very good job of managing that risk for our governmental entities. So wasn't trying to be fresh. There's an actual answer.
Thank you very much.
Thank you, Mr. Chairman. Thank you, members of the committee.
So there's no further questions or discussions. We've got, we're gonna vote on the amendment, so all those in favor of amendment 1016S, say aye.
Aye.
All those opposed say nay.
Move on to pass as amended.
Second.
So the question is ought to pass as amended. Any further discussion before we call the vote? All those in favor say aye.
Aye.
Any opposed?
Consent.
Senator Avard moves consent.
Second.
Senator Birdsell seconds that. All those in favor say aye.
Aye.
Any opposed? All right.
You want me to take it out?
Oh, you want to take that out? Senator Birdsell, we'll take that out. 5 minutes.
We have a-
Do we want to do snap?
I'm fine with that. Sorry?
Yeah, we have.
With you all the FNs?
Yeah.
Okay, so let's take up 615 FN. I will move on to pass.
Second.
So Senator Avard second that, Sophie, and then I am going to move amendment.
Hold on. Slow it down.
Yep, you let me know.
Thank you. Yeah, got the amendment.
I'm going to move amendment 2026-1007.
Second.
Senator Birdsell seconds that. And I'm going to speak to my amendment. I don't think that the intention or motive of SNAP was ever to buy junk food when it was brought up. I think that just the name in itself, in a supplemental nutrition, I don't think candy bars would ever be taught in a high school nutrition class as supplemental nutrition. So with that being said, what seems like a very simple, straightforward topic, as we work through this and the many, many hours of discussion I've had on this, I came to realize that it's much more difficult to say no junk food than it's much easier to say no junk food than it is to implement no junk food. We heard from a variety of stakeholders, everyone from the Department of Health and Human Services on down to the convenience stores, down to the food bank, saying that there are a variety of issues that need to be considered, and I agree with them. I agree with every one of the people that brought up the fact that there are a variety of issues that need to be brought up. So although I personally don't think that taxpayer money should be buying food that has zero health benefits, I also appreciate the fact that this is a very complicated and complex issue. So that being said, bringing forward Amendment 1007, because I think the amendment does exactly what we can't do in a very short time period. Is it brings all of those folks together and it brings all of those concerns together, whether it be the folks from Department of Health and Human Services who have to administer this, to the people that are using these benefits to purchase products, to the people on the receiving end that are accepting payment for this process. And this bill, this amendment sets up a commission to dig in deeper to the issues and come up with some recommendations that we can implement in a time frame that is slowed down than what we're currently under. So if you look at the paragraph 2, it sets up the composition of the commission. It has representatives of the Senate, one of which will be a member of this committee. And then one of them may or may not be a member of this committee. It also talks the same representation in the House. The governor will have an opportunity to appoint folks that are receiving SNAP benefits. There are other entities involved, including DHHS, folks from the industry that this would affect, whether it be the beverage industry, the grocers industry, the convenience store industry. We have representatives of the New Hampshire Food Bank, and probably the one that I'm really interested in, particularly interested in, is page 1, line 31, a representative from the Double Up Food Bucks program, which, as you recall, I think for me personally, I would rather see money being spent on SNAP being worth more when they're buying good food. And the Double Up Food Bucks program does just that. I think that their input would be valuable to that. And then we have other industries represented, including New Futures, BIA, the Farmers Market, New Hampshire Hunger Solutions, New Hampshire Legal Assistance, New Hampshire Medical Association, and then the New Hampshire School Boards Association. I know it's large, it's a large commission, and I get a little hesitant with that because I've been on some large commissions, but I think every person that we spoke to during the hearing, every person I spoke to subsequent, has a perspective and brings up nuance to this program that I think needs to at least be considered, at least be heard in a format that there can be discussion about. They'll have to report to us on a time period, and this is a commission that is not going to go on forever. They've got a time period where they have to submit a report to this, and quite frankly, it's my hope that we can reform SNAP, but do it in a way that is meaningful and has the most impact and ultimately yields healthy outcomes. For me personally, that's my goal, is a healthy outcome and a healthy use of this money, rather than some of the stories that we've heard. So that's what the amendment does. Is there any further discussion on that?
Yeah, but not,
Senator
Prentice had her
Prentice.
hand up first.
Oh, thank you very much, Chair Rochford. So one of the best things in the last few years that this committee, and actually I think it was before I was on this committee, but this committee addressed and has been a benefit to SNAP recipients in New Hampshire is expanding the ability for them to use their SNAP dollars at farmers markets, which farmers markets we largely see locally grown produce, dairy products, things that are more, say, on the healthy, not said, yes, they're on the healthier side of the nutritional pyramid. So I think that is one of the best things that we've done, and I am interested in how, in working with this commission, and I can support this commission, we can unpack these complicated issues, incentivize healthier options for those that receive SNAP benefits. I also want, so just like we've done in the past, I think it's important to note, and I want to unpack what the threshold, I'm concerned about what the threshold is for the federal poverty level so that to receive SNAP benefits so that we don't create more food insecurity, but create more food security with more nutritional enhancements that are available, and that we find a way to strike a balance with the protection of the Department of Health and Human Services to give them the flexibility that they need when they come across complicated situations with families in New Hampshire. The last thing that I'll say is that making sure that anybody that accepts SNAP benefits now remains in the mix, because this commission comes out with a program that keeps them in the fold rather than makes it harder for them to participate is important to me. So thank you for your work on this. It's complicated. I look forward to seeing the work of the commission, and hopefully maybe I'll be able to be involved. Thank you.
Senator Abard.
Thank you. This is a replace all, basically.
Yes.
And I won't be voting for the amendment because I do support the underlining bill. I am worried about compliance. I know that that's been an issue. But if the committee ends up voting for this, I will support it ultimately. I think no matter what the commission comes up with, there's always going to be opposition on fixing this program. And I think, we have talked about this many times in the past. It just keeps coming up. This is an issue that everybody's been concerned with since I've been up here. I know we've talked about this. So I view this as another kick down the road, another commission, a bunch of people talking, but nothing getting done. But, and I understand where you're coming from, and I appreciate the spirit in what you're doing. But from my own personal experience, I feel like we should put something put the rubber to the road here, and this bill would ultimately do that. Like I said, if the committee wants to pass this, then I'll support it. But I would prefer the underlining bill.
Thank you. Any further discussion? Senator Bertzel.
Thank you, and thank you for your work on this, but I have to take some umbrage with the commissions not doing anything, because as the chair of the PTSD Commission, we've done a lot of work over the past 7 years, and we've put a lot of good information forward on PTSD. So there are good commissions out there that do a lot of work. Thank you.
Senator Long.
Thank you, Mr. Chair. I believe firmly that having people make their own decision is best. Telling them they can't do something, they don't get that, and that usually slips off. I recall when legislation doubled up on farmers markets. I remember in Manchester going to a farmers market and seeing people buying lettuce and tomatoes twice. You pay for double. You pay the single amount for double, and I think that's their initiative to do that. I think that's a better way to get people to start thinking of their health.
Great, thank you. Any further discussion? So on the amendment, all those in favor say aye.
Aye.
Right?
Opposed?
No.
The amendment is 4-1. I'll move on to pass as amended. Senator Bertzel seconds that. All those in favor say aye.
Aye.
Right?
Opposed? And I'll move consent.
Second.
Senator Abard seconds that. All those in favor say aye.
Aye.
Right?
Opposed? And I will take that out.
I can take another. So you already have a few more.
You want to take that out, Senator Long? I'll let you do that.
Okay.
Feel free to delegate.
All right.
It's not two. Yeah. Only got one right now.
Yes. Let's see. I'm going to jump ahead a little bit to Senate Bill 670. All right, 670. On 670, I'll move on to pass. Senator Birdsell seconds that.
Any other amendment?
And then I'm going to move amendment 0912S. I believe that's the most current. Yes. So yeah, move amendment 0912S. I can get a second.
Oh, second.
All right. Senator Birdsell seconds that. So as we know, this is the bill establishing a developmental services oversight commission relative to reporting requirements regarding death of a child. This amendment was drafted in consultation with the Department of Justice and the folks in HHS that came in and found some issues with the original draft. This is taking into their recommendations and, trying to coordinate between 2 or 3 different departments here. I think the goal was when DOJ came in, they said the way it was written, it would capture 4,000 deaths a year, and that wasn't the intention of this. So if you look at the original bill, it deletes section 3. If I can get the original bill. And replaces it with what's before you right there.
On page 3.
Section 3 on page. Yes.
Okay.
Section 3, page 3, and it removes that section. That was the one that delineated this, what the composition of the committee would be. That seemed to be a sticking point. And given the time that we're under, I felt that it was best to keep the bill moving forward. I think that there was some talk about, and I know this came up initially, is to push this off for another year. I don't think it should be pushed off for another year. I think that some of the issues and concerns we heard are things that we can begin work on. By no means is it going to be over with this, but we can begin work on with this amendment and keep the process moving forward. So are there any discussion or comments on the amendment? We'll call the question. All those in favor say aye.
Aye.
Any opposed? So a move ought to pass as amended.
Second.
Senator Birdsell seconds that. All those in favor say aye.
Aye.
Any opposed? I'll move consent.
Second.
All those in favor say aye.
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 Opposed? And that's my bill. I can take that. I know we have a hearing that was supposed to start at 9:45, and I apologize for running late, but we are under a deadline today to get the fiscal note bills out. I know you're all gonna groan when I say we're gonna go into recess for a few minutes so we can caucus on a couple things. We'll be back. All right, welcome back. We're out of recess. And we're continuing on our executive session. Let's start with 664. Limiting hospital executive compensation in communities designated as distressed place-based economy under certain circumstances. I move ought to pass. Ought to pass in a second. Any discussion?
I,
If you're not, Senator Prentice has her hand up.
Oh,
I
thank you.
think you did anyway.
I did. Oh, yes, I did. Chair Rochford. So I've been very conflicted, having lived and worked in healthcare in the North Country, which is the distressed area that is, this bill targets, geographically, with the complexities of running healthcare systems in the more rural areas and other efforts that I'm involved in to stabilize systems of care. But my part of my conflict comes with the, seeing the compensation packages, from seeing the space in between all of the people that work in these systems in order to make them work, which is that's a concern of mine. I also know, and we heard that the charitable trust unit is looking into I think it's the word investigating, but looking into these the same concerns that have been raised, and we are expecting a report any time now, which could bring more light or confirm the direction that the committee chooses to go in. So I'm conflicted, but I'm gonna go with the ought to pass motion at this point.
Great. Thank you. Any further discussion?
I'm,
Senator Abard.
I think this is setting a very bad precedent. I think we start here, and who's next? If we target if we target up north, I think this is opening up a Pandora's box that could go down a slippery slope that we're not going to be comfortable with in the future. I think telling the boards that elect these people or try to find these people to run these hospitals and administer their hands are going to be tied. Well, you can't do this, you can't do that, because the state's going to come in and say no. I think this is a very, very slippery slope. I have very serious concerns with going forward with this. So I would be voting no.
All right. Any further discussion? Call the question. All those in favor say aye.
Aye.
Opposed?
No.
So 4-1. And I am going to not put this on consent and take it to the floor. I'll take it out.
I'm a drag today, huh? Jeez.
Woke up on the wrong side of the bed, I guess.
No, you guys did.
I didn't get enough coffee. Let's move on to 665. I move ought to pass on 665.
I'm going to second that.
So I'm going to move amendment 0895S.
Second?
Second. So this has been the year of pharmacy benefit managers and pharmacy benefit managing legislation. And this is a topic that I have personally been involved in for probably 20 plus years in the legislature, long before I came here, and long before anyone even knew what a pharmacy benefit manager was. And I'm not saying that that term is widely even recognized now, but it's becoming more recognized. We've done some things over the years in fits and starts. Some have been big things that failed. Some have been little things that passed. We've got really good things on the books here in the state of New Hampshire regarding audit protections, protections against certain types of clawbacks. But at the end of the day, this industry is largely unknown. And you know, they operate in one of the largest revenue aspects of our economy nationwide. They are owned, in many cases, vertically integrated from the time of the insurer all the way down to where prescriptions are dispensed. We've had a lot of robust discussion this year. We've had a number of bills. And I've worked very, very hard. I think between this and the SNAP bill, I've put in more hours than my $100 a year could begin to cover. But I think we have something here in this amendment that is meaningful and not over aggressive, but something that moves the needle in the right way. And I think the difference between this year and in the 20 years that I've worked on this is we've got a number of senators, both sides of the aisle, that have, you know, recognized the issue and worked towards a resolution. We have a department that has been, kudos to the department that's here. I think that they probably get sick of me calling them on this because I call several times a week to discuss this and have discussed this. Understanding what the overall issue is, where some other states have gotten into troubles, where some other states have gotten had successes. I really pressed and pushed the department to thread that needle. I didn't want to get anything that was overly aggressive that would either get struck down in the courts or, you know, not have a chance as it moves out of this body. But on the other hand, I wanted to do something that was meaningful and transformative in this arena, and I think this amendment does it. And just to give you a couple things that what this is doing. One, it changes who has to be licensed and registered in with the state of New Hampshire as a pharmacy benefits manager. Previously there were exclusions to this definition that carved out a number of entities. This removes that exclusion. So it will enhance the department's ability to regulate these entities and register the entities. So that's going to give them a better look into what's going on. The other thing that we did was we talked about our PBM's fiduciaries. And, you know, although it's not specifically defined in this by word, and the department says they always have treated PBMs as fiduciaries. We clarified that PBMs are fiduciaries in reference to statute in this agreement. I know Senator Rosenwald, that was very important to her. That was something that we got in there. And I think the biggest premise amongst all of this, when the department came in, you know, they said, you know, there are 3 or 4 different buckets that you can go into when you look at PBM reform. And the one that resonated with me as not only someone who sits on this side of the bench, but also someone who's been on the side of the bench of pharmacies, is transparency. So as we look through this amendment and I worked with the department, I said, I really want as much transparency as possible. What does transparency look at PBMs? It looks at what's the gross price of a drug? What's the net price of a drug? Where are the rebates and discounts going? Who gets the rebates and the discounts? You know, we're told oftentimes that, you know, the rebates exist and they go back to the plan to lower premiums. Well, you know, this bill will allow us to actually see in an aggregated form how much of that rebate is going, and we can watch premiums rise or fall depending on that. And it increases the reporting time of that transparency to every 6 months. And we'd heard everything from a quarterly reporting to a annual reporting. working with the department, we settled on a 6-month reporting. They felt that that was a manageable number, not so much that it's overwhelming and doesn't give you enough or doesn't give you useful information if it's, quarterly reporting, but also increases the cadence so that it's more frequent than annual reporting where, sometimes it can take a while to get those effects. And so that's the other thing that it does. It codifies some audit protections and clawbacks. And so if a PBM initiates a clawback, an appeal can be filed, and that clawback doesn't take place until the appeal has been played out. The other thing that it does is it works in Senator Fenton's language that we passed earlier about formulary changes. That was incorporated into this into this amendment as well. And it allows it to delineate fines where if there is a violation, the fines can be separated out so that these large entities are paying what used to be $2,500 fine to a $10,000 fine for repeat or continuing violations. And I've heard sometimes it's cheaper to pay the fine than to go through remediation. And we're hoping that that gives them a little extra teeth on that to do that. And then that's what I think it does. But if I missed anything, if the department wants to come up, I think we've got everything here. There was a lot here, and again, I want to thank you publicly, Commissioner, your entire staff. I mean, we've met a lot on this over the last several weeks, and I appreciate all the work.
And Mr. Chairman, I appreciate your kind words there. It was a pleasure to work with you. You had quite a difficult task. I think you've summarized the amendment incredibly well, but bringing together what is an amalgamation of a number of different pieces of legislation and taking the best aspects of them and bringing them together and making it all work was a real art form. And Michelle and our team and you, Senator, I think did just a wonderful job. I'll let Michelle get into any specifics that she feels should be highlighted additionally. But to your point, Mr. Chairman, I think the key was, as you mentioned, when we started this conversation, I suggested a bit of a methodical and structured way to think through it. And the first question that I suggested had to be asked was, what is he looking to accomplish? And I think that you did a good job, Mr. Chairman, of making it clear what we're looking to accomplish is to increase transparency into this process to enhance the free market system. Because that transparency, at the end of the day, is one of the most important aspects to a functioning market. Because when you have the information, then the market can move and react based on that information. And so with that premise, I think came a lot of good things. Michelle?
I think you did a great job summarizing it. The one thing that I will just expand upon a little bit is that under our current PBM law, the way PBM is defined, there is a carve out for those carriers who have their own PBMs. And so they're not falling currently under the definition of a PBM. That doesn't mean we're not licensing them. We will then license them as a TPA. And so what a lot of this amended language does is kind of gets rid of that carve out. So if a carrier has their own PBM, they will now have to register as a PBM. So we're treating all of them the same, but we're not expanding that beyond the markets that we currently regulate. So it is still limited to that fully insured market to try to avoid any potential litigation with respect to trying to regulate other markets like Medicare, Medicaid, self-funded. And in doing that, we didn't just clean up the definitions. We tried to mirror a lot of the requirements that are in the TPA statute and put them into the PBM statute. So it'll be more of a seamless transition, and to make sure that these entities are being held to those same standards.
And one thing I failed to point out is the topic of spread pricing. And that's been, again, perspective has changed a little bit on that. Not that I'm a fan of spread pricing, but we left it as an option. We didn't flat out prohibit spread pricing. And I think some of the testimony that came forward on that was, maybe some of these smaller entities that don't own their own PBM use spread pricing to mitigate maybe some upside down reimbursements, and they spread it out. And I really pressed in on one of the representatives from one of these organizations, and you're leaving money on the table. And they said, well, we'd rather I think the words were, we'd rather work with the devil we know than the devil we don't know, in that, yes, we know we're leaving money on the table, but if there was a unanticipated change in pricing, that would make sure we're not losing. So it's an option. And I think we made that trend, and that was part of the amendment, is they have to be transparent. This is for if you go with spread pricing, this is the deal. If you don't go with spread pricing, it has to be laid out to the plan sponsors on that.
And to your point, Mr. Chairman, I think you were very wise in preserving models, not taking models off the table, but ensuring that there's accountability and transparency in those models. You preserved the flexible rebate pass-through options. Those are preserved. Michelle had mentioned it in one of the things that I know we all worked hard on, was ensuring that we were respecting federal jurisdictional limits. And the question recently was asked of me, why isn't the state plan subject to this? Well, two reasons. One, legal, which is our state plan is a self-funded plan, so it's governed by ERISA. So we just don't have jurisdiction over those plans. But secondly, to the extent that there's a price shift in one direction or the other, I don't think you'd want to take that on mid-budget cycle. You'd want to wait. So even if we had the jurisdictional ability to do so, I don't think you'd want to move forward with the state plan at this point anyway.
Thank you. Are there any questions of the department? Again, thank you very much for
Thank
all
you.
your work on this.
Appreciate it.
So the other question that has come up is, which bill do we, I think I was very clear that, when we saw a lot of these pharmacy pricing bills, PBM bills, it was very clear one's going to move forward. We're not going to put forward three different ones. One is going to move forward. I chose 665, although it was a late bill. It did have 14 senators on it, 7 from my caucus. There's good bipartisan support. There's good support from a variety of senators on that, including leadership. And that was the reason I chose 665. And you'll notice that 665, the amendment in front of you, is a replace all amendment. So if you're wondering why I chose this bill, that's why. Is there any further discussion? So call the vote on the amendment. All those in favor say aye.
Aye.
Opposed?
Ought to pass as amended?
Pass as amendment. And we've got a second from Senator Birdsell. All those in favor say aye.
Aye.
Opposed? Move consent.
Consent?
All
Second.
those in favor say aye.
Aye.
Opposed? And I will take that one. I don't know how many I've taken on today, but yes. So that leaves us 478.
And 666.
Oh, yeah, we'll hit 478 first. And I'll move interim study on that.
I'll second that.
I'm just going to speak to my amendment. I want to thank Senator McHugh for bringing this up in 478. Between him and Senator Rosenwald's work on a previous bill, they really formed the foundation for which the amendment on 665 was built on. I was able to take aspects of both bills, working with the department, figuring out ways that we can get the objectives met with both of those bills, and that's what we did with 665. So I want to thank him for his work and the co-sponsors. There were 6 senators on that bill, and and a variety of folks. And I just thank him for that. So, no, not reflective of the work here, but interim study, I think that's the best move, given 665 has already passed out of committee. So with that, I'll call the vote. All those in favor say aye.
Aye.
Opposed?
Nay.
Nay. So we got 4-1. Would you be opposed to consent?
No.
All right. So I'll move consent.
Second.
Third.
All right. On consent, all those in favor say aye.
Aye.
Opposed? All right. What's that?
I'll take that.
She
Get a
gets
break.
one.
I love this too.
Oh, yeah, two, I would take more.
Brennan?
All right. The last FN bill we have is Senate Bill 666.
I'd like to make a motion of, ought to pass on 666, and if I have a second, I'd like to propose an amendment.
Second.
So we've got Senator Prentice ought to pass, and I heard Senator Long.
Great. Thank you, Chair Rocher. May I introduce my amendment?
Yes.
Okay, and actually, this was, I'm introducing this on behalf of my colleague, Senator Alschler from District 24. This is Amendment 202609997S. So based on the hearing and testimony and feedback, this amendment tightens up the language. It focuses on private equity and consumer protections. The broad strokes here are that it extends the review period to 90 days, that it specifies that after an investigation takes place and there's a finding, there can still be a review. And it also puts into place a protection for, puts a protection in place so that any public reporting maintains confidentiality. It would not be able to target towards any one particular, we wouldn't get into any type of patient or consumer confidentiality issues. So those are the broad strokes of this amendment. Again, private equity focused and with consumer protections. Thank you for the opportunity to introduce this amendment.
Any further discussion?
Senator Long.
Senator Prentice and Long, I believe, right?
Yeah.
Yeah. Yeah.
Thank you, Sophie.
Any further discussion? I am going to talk a little bit about this. So I'm going to talk about the underlying bill, which came to us, and it was really a big issue and a complex issue. And I was a little anxious. We got this first bill 2 weeks ago. And I knew it was complex because I've been working with the CTU or corresponding with the CTU over the last several months, going back to probably August, September, and really understanding what they do, what their role is. I know they're currently involved with a review of some hospitals up north. They're currently involved with a review of a merger that's, or an affiliation agreement that's currently taking place between Dartmouth and Littleton. So I've had some time to speak with CTU and really understand what they do. And looking at, the original bill, well, the first thing that jumped out at me was the 30 days, which I recognize was addressed in the amendment. But I felt like on first glance, a lot of this stuff was being addressed. And I thought the timeline was not realistic. And then I felt like knowing their resources and what they have available to them, this would overwhelm them. And we heard from CTU, they came in on the hearing, and she confirmed some of my suspicions in that the timeline was aggressive, that there was some duplication of effects. But then as she began to discuss more, I felt like this issue was far more complex than the way it was being presented. And so I had a follow-up discussion with them on February 20th. And I said, listen, this is I know what goes on in this. And I'm a little nervous that we have a very short period of time for my members of the committee and ultimately the whole Senate to wrap their brain around what the complexity of this. We just heard from, a previous bill, PBMs. I know how much time went into that. Similarly complex, but in a different way. So my question to her was, is there anything you need to do your job that you don't have now? And she said, well, let me think about that. She goes, no, not really. This wasn't from us. This original bill did not come from us. We just came to testify. And she said, no, I don't think so, but let me think about it. So the senator did bring in this amendment. She said she did speak with the CTU last week. And again, was kind of surprised that I hadn't heard from them given the conversation I had on the 20th. But in our break, I called the woman who was here speaking of the CTU, and I said, tell me a little bit about the amendment. And she said, we were approached. The amendment is an improvement on what the original bill is. She said it definitely improves it. And my next question to her in the conversation in my office just a minute ago, I said, is there anything in here that you absolutely need that can't wait for to explore this a little further until next year? And she said, no, there's nothing in this that we absolutely need right now. So with that, I am not going to support the ought to pass motion, and on the amendment or the bill for that matter. So Senator Prentice.
Thank you, Chair Rochard. I appreciate always the diligence by which you do your job. And I hear your comments. I just want to once again echo giving, thinking back on, or giving, the word giving out, thinking back on discussions that we've already had today, we've had previously about our 26 acute care hospitals and our healthcare system, that we've seen what happens when private equity does come into the healthcare space. We have a bad example of it just to the south of us. Anything that we can do to improve the protections for the consumers that are focused around that is where we want to be. So I'm going to continue to support this, but I do appreciate, again, how you have moved forward with your work. Thank you.
All right. Any further discussion? Senator Long.
Thank you, Mr. Chairman. Just for transparency, I sit on the CMC HCA Board of Trustees. Although the amendment is just private equity, the original bill included for profits.
Great, thank you. Any further discussion? With that, the motion is on the amendment is ought to pass. All those in favor say aye.
Aye.
No?
Aye.
All right.
Wait, I gave you
I
some
like to
time
raise
there.
I'm a
All right.
hand raiser.
All right.
Aye, yes.
All those opposed?
No.
No. It's 3-2. The amendment fails. So the motion on the bill is ought to pass. All those in favor say aye. Raise your hand.
Aye.
Senator Long, you and I on the bill? All right.
No.
So all those opposed say no.
Original bill.
So it's,
Yeah, the original.
the ought to pass is 1-4.
So,
1 yes, 4 no.
so motion to interim study?
Senator Prentice. Yep.
So it didn't pass on ought to pass,
So
so
the
we need a new motion.
Motion fails. Yep.
Right, so motion to interim study.
Motion is interim study. I have a second. I got a second from Senator Birdsell. Any further discussion on the motion of interim study? All those in favor say aye.
Aye.
Opposed? 5-0. Interim study.
Consent?
Move consent. I'll second that. All those in favor say aye.
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 Opposed? And do you want to take that out, Senator Abard?
No.
All right.
I'll take it out.
All right.
Thanks for asking.
All right. I just wanted to make sure you weren't missing out.
No, appreciate it.
So we are still in executive session. Is there anything that needs further for executive session?
Did you do 670?
Yes, you were here.
Oh, okay. You
Yep.
already did that. All right. Motion to move out of exec?
Second.
All All those in favor say aye.
Aye.
Opposed? All right, we have some work to do today.
They are.
So with that, I'm going to open the hearing on Senate Bill 453, authorizing advanced practice registered nurses and physician associates to make certain certifications. With that, I'll ask Senator Prentice to introduce her bill.
Good morning. Yeah, it's morning. Good morning, members of Senate Health and Human Services. For the record, my name is Sue Prentice. I'm the state senator from District 5, representing 15 communities, largely in the Upper Valley, part of Sullivan County, and one beautiful community from Merrimack County, New London. I am introducing Senate Bill 453 today. This bill is focused on increasing access and efficiency in healthcare by allowing advanced practice registered nurses and physician associates to perform certifications that currently physicians can only do. So this would reduce delays for patients needing disability waivers or medical immunization exemptions. So again, over the past few years, I've come forward with similar bills, and Senator Rochford, you've had a like bill to help bring equity between the physicians, the nurse practitioners, and the physician associates where we can, especially when we think about access to healthcare and how we move people through the system and where these delays are taking place. So these are two fundamental changes. One has to do with vehicle equipment waivers for people with disabilities. So an example would be if you needed hand controls because you were unable to use your legs and you needed hand controls around the steering wheel and on the dashboard in order to manage your vehicle. Pedal extensions for motor vehicles. These, for somebody who is unable to reach the pedals because of a disability, an amputation is an example, as well as a congenital shortened extremity. These are standard waivers that are provided by physicians, but not everyone can get in to see a physician, and they're seeing our physician associates and our nurse practitioners. So we would be bringing basically equity there. And the second is medical immunization exemptions for children. So this would be where, and again, physicians can already do this, if there's determined that there could be a negative impact, the exemption could be signed off by the physician. So this becomes an exemption. It's already something that's in statute. It's just that only physicians can sign off on this. Now our nurse practitioners and our physician associates could do this as well. And this is for the time period that the clinician determines that immunizations could be harmful. So that is my those are my introductory comments. And I'm happy to answer any questions you might have. I believe there's some people from the department here. We may see some our friends from the nurse practitioner or potentially physician associate communities. But again, this equity levels the playing field, removes delays that are unnecessary by allowing in these areas where these folks can already provide, comparable care to providing comparable signatures for these types of waivers. Thank you.
Thank you. Are there any questions for Senator Prentice? Thank you very much. Chair calls Aubrey Friedman.
Mr. Chairman, committee members, Aubrey Friedman, I live in Bridgewater. I speak in support of this bill. This will, as was mentioned, will make things easier for patients by allowing these two categories, physician associates and advanced practice registered nurses, grant these waivers and exemptions. It just makes it easier for everybody. And I think that less bureaucracy is good for everybody. And I don't think this is a public health and safety issue. It's just not a big deal. Now, also, in rural areas, I think this would be especially helpful, just having more flexibility. And lastly, there's clearly a shortage problem in the healthcare industry throughout New Hampshire. And just having, letting people who are already knowledgeable, they're trained, they've got experience, letting them take over a few little things that doctors do, and then that frees up doctors to work with patients more. So this is kind of a win-win for everybody, and that's why I support the bill. Thank you.
Great. Are there any questions for Mr. Friedman? No, thank you very much.
Thank you.
That's the last person I had signed up to speak on 453. Is there anyone else who'd like to speak on that? That, I'm going to close. Oh, we got one more.
Good morning.
Good morning.
Kim Mohan with the New Hampshire Nurse Practitioner Association.
Oh, you're right. I missed that. I'm
It's
sorry.
okay. It's all good.
Go ahead.
All right. So I'm here representing NHNPA, and I just have a little handout for you guys to help give context to the group that I'm representing. Not that I can't speak for the PAs, but I can't. But I wanted to just remind everybody here sort of that the umbrella network for the APRN. So when we say APRN, Advanced Practice Registered Nurse, they changed it. So APRN, so that includes about 2,300 providers. And then we have a segment of that provide primary care. They're your nurse practitioners, and they provide acute care as well. And then you have your CRNAs and your midwives all within that circle of APRN. I just want to make sure that we get that to remind everybody of that. And I want to just take a second and reiterate that APRNs are preferred providers for many, many people in this state. They're not second choices. They're not, our providers are not being seen because they can't get in, a patient can't get in to see a doctor. They're doing it because they choose to see an APRN. They choose based on their philosophies, how their practice is different, their trust and their expertise. So I just want to remind us that the APRNs are, and the physician associates are incredible resources to our primary care network, not just a solution to not being able to see physicians. That being said, we know through all of our other legislation that's been passed in New Hampshire that our legislature knows that and respects that. We passed the Global Signature Bill just a couple of years ago, which should have probably fixed these types of things. That bill basically says that an APRN can sign on a line that says physician if it fits within their scope of practice. What we've seen happen, and why we're so excited Senator Apprentice has introduced this bill, is that that's not always understood, or that it creates a lot of extra paperwork, right? So my APRN puts in the paperwork to the DMV, it gets returned, she goes back and says, hey, we have this global signature bill, I should be able to do this. The DMV comes back and says, I don't think that really covers you, da-da-da-da-da. Why don't we just change it and make it read the way it should, which is that these guys should be able to do these things. So thank you.
Are there any questions? Thank you very much.
Thank you.
And that was the last person I had signed up for. Is there anyone else who'd like to speak on 453? With that, I'm going to close the hearing. And I'm going to open the hearing on 613 relative to licensing requirements for healthcare facilities established within a 15-mile radius of a critical access hospital. With that, I'm going to ask Senator Prentice to introduce her bill.
This one.
Where's the gavel? I would like it right now. And so, it's okay. Colleagues, once again, good morning. For the record, my name is Sue Prentice. I'm State Senator from District 5, representing 15 communities in District 5, largely in Grafton County, some of Sullivan County, and one in Merrimack County, the lovely town of New London. I always have to single them out because it's just this one town of all these others. So I'm introducing Senate Bill 613, which is the Rural Health Care System Stabilization Act. The purpose of this bill requires healthcare facilities to notify nearby critical access hospitals when they plan to establish services within a certain distance. So the key provision here is that any entity, I call them a freestanding entity, but I'll review the facilities that are covered, that chooses to open or establish their practice within 15 miles of a critical access hospital, they would have to provide written notice to that hospital. This notice would need to be sent by certified mail to the chief executive officer of the critical access hospital, and the notice must include a description of the proposed facility and the services. Here are some of the services or facilities that would be covered by this: ambulatory surgical centers, emergency medical care centers like urgent care centers, birthing centers, walk-in or drop-in care centers, dialysis centers, or other specialized healthcare services, as well as somebody who wants to establish an entirely new hospital would be covered under this. So the overall impact here is that, again, looking to protect and to stabilize by ensuring that critical access hospitals are informed when new healthcare facilities plan to operate nearby, allowing them to prepare for potential impacts on services, staffing, and patient volumes. And let me just tell you a little bit about why this is important. And it's like I always like to read. I'm one of those last chapter of the book first kind of people. So the last chapter, which I would normally say at the end, I'm going to say now, and then I'm going to make a few key points, is that critical access hospitals are often the only lifeline for healthcare in rural communities. Policies that protect the stability and ultimately will protect the health and safety of the people who rely on them every single day. So rural hospitals, what we know right now, they are essential access points for healthcare. They may not be able to provide every service, but it is a local service where a patient and their families can access care, and if they need to be moved someplace else, they can. Many times they are a key stabilization point for our critically ill, including our trauma care patients within the state of New Hampshire, and there are many miles at times between a critical access hospital and a tertiary care center. If we were to see critical access hospitals become more limited or potentially close because of a competitive nature of one of the facilities covered that I mentioned, that would create even greater distance between an access point to healthcare and tertiary care. I can remember the days of riding in an ambulance before we had a helicopter, and when there were very few paramedics in the North Country, with critically ill patients on snowy nights like last night, between a small critical access hospital and a tertiary care center. And that's long enough as it is to get that care. Anything that could impact and create a problem, impact that and create more distance. And it's not just geographical distance, it's staffing distance and access distance we should be really attentive to. Rural hospitals already are operating on thin margins. We have heard from federal officials as well as they have sounded the alarm, and we know here at the state with the Rural Health Transformation Project program that we are working to focus more on these rural hospitals, financial instability and workforce shortages. If another entity would come into that area and potentially draw staffing away, it could destabilize and create a shortage, which would create an access to care issue at that rural critical access hospital. Protecting rural hospitals protects rural communities. And this is one place that all of you all know that, healthcare and providing healthcare and access to is so important to me. But when I think about my time living in the North Country, one of the things that was so clear to me is that these critical access hospitals are not just where care is provided, they are where people are employed, and they become a focus of stability, an economic hub, and a community continuity hub. It's a central point within these rural communities, and anything that destabilizes those is going to draw away and could potentially, destabilize that entire community. Where will those people work now? Will they work at one of these facilities that are covered, or will they go someplace else? Where will people get their care? Where primary care practices are affiliated with rural critical access hospitals, will they, see a change in their status and ability to operate? These are center focuses and hubs. And that is one thing that I really know from having this lived experience in the North Country. Federal leaders have recognized this crisis, and we did hear from the Secretary of Health and Human Services in testifying before the Senate in 2025 that he emphasized that rural hospitals are the centerpiece, which I was just describing, of many communities and essential to their survival. So at the federal level, this is being recognized, and the alarm has been sounded there as well. Advance notice of these types of potential facilities, entities coming into these areas allows for the local critical access hospital to make an assessment, to provide, written notification, notice and a time for review because of the concerns that they have. I'll end this by saying my goal here is not to limit competition, but to ensure that the rural facilities that we have right now are properly protected and shored up, as they are essential to the survival of those communities, the patients and the families within them. And one more time, critical access hospitals are often the only lifeline for healthcare in rural communities. Policies that protect their stability, protect the health and safety of the people who rely on them every day. Thank you. I'm happy to answer any questions you may have, and if I don't have an answer, I'm happy to get it for you.
Thank you, Senator. And just, you hit on this in your closing remarks, and I just wanted to underscore it a little bit. This is not preventing ambulatory surgical centers, pop-up emergency rooms, standalone emergency rooms, hospitals, birthings. This isn't preventing them from coming in anywhere. It's just notification
It's notice
that they're
and
coming.
review. Sorry.
Yeah, go ahead. So I didn't hear what you said.
Notice and review.
Just notice and review. There's no prohibition on competition, trade. I think sometimes that can get confused. So I just wanted to confirm that, and you did confirm that. Thank you very much. And then one of the other points I think you brought up that I just wanted to, dig into a little bit is, you bring up that these critical access hospitals are care centers for small communities. One thing that's often maybe overlooked in our committee here is that they're also the largest employers in these communities. So, I recognize the fact that absolutely care is important, but also as far as economic development, and that's just to add to your comments. All right.
That center.
Yes.
I want to keep the focus on that center.
Thank you. Are there any questions from the committee? No, not yet. Thank you very much. The chair calls Aubrey Friedman.
Mr. Chairman, committee members, Aubrey Friedman, I live in Bridgewater. I'm sorry, on this bill, I oppose it. And it is basically an anti-competition bill, was already mentioned. I think the way the law is now, it's just a new hospital coming in has to notify the existing hospital. And this bill expands it. I think it's moving in the wrong direction. It adds the 6 categories that was already mentioned: ambulatory, emergency medical, care center, birthing center, drop-in, dialysis. And this last category is so broad, special healthcare service, that'd be virtually any medical service at all. They're going to have to, I mean, that's so broad, that's anything. Now, I understand about the stability thing, but if and these are very specialized services, if a new company or a new enterprise comes in to provide one of these specialized services, if it's not needed, it's going to go belly up and nobody's any the worse. So, but maybe it is needed and maybe patients are actually going to go there, which is, why isn't the hospital or the critical access hospital providing these services? Now, maybe it can't, due to financial resources, that's fine, but why would the hospital be concerned if somebody else comes in to provide services that you can't provide? In fact, you should be happy that there's another, somebody coming in to provide services. And if it's services you provide, if other patients choose to go there, maybe there's a reason that they're choosing that particular service and not your hospital. So competition is a good thing. And I think this is clearly to discourage or to put another mandate on new businesses coming in, just to make it, and it's noted, it's just a notification, but it is something else you'd have to do by law. And if you didn't, you'd probably get in trouble. And my last point is this RSA 151 4A, Roman numeral 2A, that's what it's changing or repealing and rewriting. That is completely in the wrong direction. We should be repealing that clause and not replacing it with anything. We should encourage to have more facilities we should be thinking about patients and the public, not be thinking so much about buildings and hospital institutions. It should be about consumers and patients. That's the primary thing. And if they benefit from having these other specialized services around, then I think the emphasis should be on that. We should encourage that and not discourage it with an extra mandate. And those are the reasons I oppose the bill. Thank you.
Thank you. Are there any questions from the committee? Thank you very much.
Thank you.
Ben Bradley.
Thank you, Mr. Chairman and members of the committee, for hearing my testimony on this important bill. For the record, my name is Ben Bradley. I am the Vice President of State Government Relations for the New Hampshire Hospital Association. We do strongly support SB 613 and want to thank Senator Prentice for her sponsoring this bill. I think you did a great job outlining the real importance of this. I do want to touch on 2 points that I think are really important for the major reasons why we feel this is appropriate to enact. First, we believe these provisions remain an important tool for the state's efforts to ensure access to care in rural communities, as Senator Prentice laid out. Without these notice and review provisions, the state is blind to the effects of a new proposed licensed facility on a critical access hospital. Second, as you know, New Hampshire was recently awarded $204 million in the first year of the 5-year Rural Health Transformation Program, more than any other state in New England. We believe the notice and review requirements outlined in SB 613 are important to ensure those federal investments are not undermined by a new facility having a material adverse impact on the very assets that the funding is intended to support, critical access hospitals. Sustainable access is a major pillar for the Rural Health Transformation Program. And I think we can all agree our critical access hospitals are vulnerable to financial challenges that threaten access to essential services in their communities. At least 7 of New Hampshire's 26 acute care hospitals had negative operating margins in 2024, including 4 critical access hospitals. These provisions in SB 613 align with the Rural Health Transformation Program's pillar on sustainable access. And for these reasons, we ask for the committee's support. I'm happy to answer any questions.
Are there any questions for Ben? No, thank you very much.
Thank you, sir.
And that was the last person I had signed up to speak. Is there anyone else that would like to speak on Senate Bill 613? That, I'm going to close the hearing. And do we want to go into executive session?
On this one that we just heard, I'd like to wait. 'Cause
Okay.
I'm talking to Senator Prentice on, but I am so moved to go into exec for the first bill.
Yep, so we got a motion to go into executive session.
Second.
All those in favor say aye.
Aye.
Opposed? All right, let's take up Senate Bill 453. I've got, let's say Senator Birdsall and Senator Avard with the second. Yeah. Any further discussion on 453? I'll call the question. All those in favor on the out to pass, say aye.
Aye.
Opposed? I'll move consent. Senator Birdsall moves seconds. All those in favor say aye.
Aye.
Opposed? And I will have Senator Prentice take out her bill.
You bet. That's great.
So motion to move out of exec. Do I have a second?
Second.
All those in favor say aye.
Aye.
Any opposed? And we are completed our business of the day. We'll be back here next Wednesday. Thank you.